Hello, guys. This is Dr. Kazmi once again, and today I'm going to present a talk on the public health aspects of the COVID-19 transmission. Before I start this lecture, I would ask you, if you like my channel, please do subscribe, comment, and also press the bell icon so every time I upload a new lecture or on a new talk, so you can get a notification that a new lecture has been uploaded. So, in this particular talk, I'm gonna focus on the public health aspects of this COVID-19 transmission, and the general outline of this lecture would be that I would be talking about the dynamics of the transmission of this virus using Bayesian methods. Bayesian modeling, as we call it. We will also discuss the role of the environmental factors in the spread of COVID-19, the role of the human factors, and the concept of herd immunity to see if how can it help in the control of the COVID-19 pandemic. So let's start with today's lecture. Now, the burning questions that need to be addressed, and usually I'm asked by people that, okay, what about this virus? Will it go away when the summer finally arrive? Or will it still continue to spread, infecting more and more people? Or will it slow down with the current measures? We're talking about self-isolation, we are talking about lockdowns, we are talking about different new model treatments, so whether it's going to be controlled with that or not. So in this particular talk, we will one by one we will look at all these issues and see whether what's going to be the shape of this pandemic in the future. Now, I will start with one of the articles which was published in the Environmental Health Perspectives. That was back in 2011, and that was titled The Global Influenza Seasonality, Reconciling Patterns Across Temperate and Tropical Regions. So usually the first thing, as I said you earlier, people are asking whether it would go away when the weather changes, when the temperatures they become hot. And this particular research, it actually looked at the influenza, and we know that influenza very much resembles coronavirus in terms that it affects the same respiratory system. The mode of spread is more or less the same, and the level of so pathophysiology, the level at which it affects is more or less the same. So looking at that, we will see if this model can be applied to COVID-19 or not. So looking at this article, it looked at the spread of influenza, and if you see over here, the influenza has, if you look at the spread from January to December in the United States of America and Canada, which are in the northern hemisphere over here, you would see that the cases peaked during the winter time, so somewhere around January and then November, December, and in between the summer season there were very few cases of influenza. The same goes for the opposite, because while there are winters in the northern hemisphere, there are summers, and when there are winters in the southern hemisphere, there are summers in the northern hemisphere. So the opposite is true of Sydney, Australia. Here you can see that the cases are less in January and December, because these are the summer months over there, and the cases of influenza, they peaked around the winter season, which was around June, July. But as far as the tropical countries are concerned, if you look around the equator, countries like Brazil and countries like Singapore, they have more or less the same transmission going out throughout the year. So from January to December, though there have been individual fluctuations, but more or less, if you see, the cases are occurring throughout the year. The same goes for Singapore. You can see the cases are more or less there throughout the year. So more cases in winters in the northern and the southern hemisphere, more of a sort of a what you call a horizontal sort of a transmission, or I would call level of transmission throughout the year. We call it a perennial transmission in the tropics. So the question is whether it applies to coronavirus or not. We yet have to see that, because influenza, we know about that. It has been infecting individuals every year. Some of the strains are those which are the same from the last year, and then there are mutated ones, and somehow there is some level of immunity in the populations. So we see a seasonal pattern as far as influenza virus is concerned. We don't know at the moment because the first time we are having a look at the COVID-19, and though it started in winters, the summers yet have to arrive. So when the time comes, it would give us an idea if the numbers they go down when the ambient temperatures rise or not. So we'll yet have to see on that particular count. Now, the if you look at the some of the other coronaviruses, those coronaviruses alpha and beta, coronaviruses which are famous for causing common cold in humans, they do have sort of a seasonal pattern that they do occur mostly in dry winter seasons. So they would peak around November to December. Sometimes they go into January and February, and eventually as the summers come, they do die down. So we do get some forms of cold in summers as well, but the numbers are quite low as compared to that we get in the winters. So this coronavirus, that is the SARS coronavirus 2, which we call as COVID-19, whether it would behave the same way or not, we yet have to see. We'll have to wait till the summers kick in, and then looking at the population parameters, that would give us an idea how it behaves. But if we have to go looking at the way the viruses behave, and those viruses which are closely related, their numbers, they do go down in summers. So let's hope that this also goes down when the ambient temperatures rises. But as I said, it's more of a speculation. We still have to see whether it actually happens or not. Now, we also have to look at the environmental factors, the human behavioral factors, and the herd immunity concept to see whether it would help or whether it helps in spread, or the whether it helps in stopping the transmission of COVID-19 or not. So we'll start with the environmental factors. And here is an article which was published in 2014 in the Journal of Virology, and that was titled Roles of Humidity and Temperature in Shaping Influenza Seasonality. So as I said, that we do not have any concrete literature as far as COVID-19 is concerned. It's just, it's a new virus. We have got a few studies coming in from China, but again, as I said, if you look at proper model studies where you have got case controls, or you have got like proper randomized control trials, we don't have data relating to COVID-19 infection so far. But we do have enough literature relate to some similar viruses like influenza. And this one article actually looked whether the humidity and temperature that affects the influenza virus or not. So let's have a look at what this article suggested. So this article, if you see here, it's looking at the relative humidity at different temperatures and see whether the transmission of frequency improves or goes down with increase or decrease in temperatures. So on the y-axis, you see the transmission efficiency. So the higher it means higher is the transmission. Lower figures mean it would be low transmission. And on the x-axis, we have got the relative humidity. So relative humidity 20%, 40%, 60%, and very high humidity conditions like 80%. And then they have looked at different temperatures. Red is 30 degrees Celsius, yellow is 20 degrees Celsius, and blue is the 5 degrees Celsius. So if you look at low temperatures, as the humidity increases, the transmission actually goes down. If you look at 20 degree is a bit unstable. You still see there are fluctuation, and there are ups and downs, but eventually as the humidity increases, the transmission goes down. But when the temperature reaches 30 degrees Celsius, okay, which are known as the summer temperatures, you will see that as soon as the humidity slightly increases, the transmission considerably goes down. And this was true in case of influenza virus. Now we expect that most probably coronavirus 2 would also behave the same way. Now, whether it would or not, we yet have to see. But as I said, using Bayesian methods, we think that it might go down. But there have been few studies in China which are actually saying otherwise. We will have a look at them shortly as well. There was another article regarding humidity and seasonal onset of influenza in the continental United States. This was published in the PLOS Biology back in 2010. Again, and it looked at the absolute humidity and whether it had any effect on the transmission of influenza in United States. Now, this article actually concludes that we extend these findings to the human population level, showing that the onset of increased wintertime influenza related mortality in the USA is associated with anomalously low absolute humidity levels during the prior weeks. So, what they are suggesting is that the peaks of the influenza in United States in the winter season actually coincide with relatively low, humid, dry, wintry condition. So whenever there would be winters and it would be harsh, dry winters, the influenza virus actually propagates. And we know that because people mostly are indoors, they are closely living together, so it's easy for them to to sneeze and to cough and spread the transmission from one person to the other person. They said these findings provide epidemiological support for the hypothesis that absolute humidity drives seasonal variation in the temperature regions. So, there is an evidence that as the temperature increases or the humidity increases, the transmission of influenza virus goes down. And they think that that might also happen in case of COVID-19. Another article on the role of absolute humidity on transmission rates of the COVID-19 outbreak. Now, this is the Chinese study that I was talking earlier about. This was preprint version 2020, and what they have looked at the patterns of transmission in different regions of China, and here in the graph you can see that it hasn't changed much. If you look at the absolute humidity, which is there on the x-axis, and these are the number of cases, and if you see, it's more or less the same as the humidity increases, though definitely you can see in the beginning when the humidity is less than 2.5%, the cases have been quite high, especially in two regions of China. So again, what it suggests is that at lower temperatures, especially in very low humid conditions where the humidity is very, very low, in other words, it simply means dry, wintry conditions, the virus replication, or in other words, the transmission is quite high. People transmit it to from one person to another person, and somehow it's easier for the virus to survive even outside the body in dry, less humid, wintry conditions. They concluded that our results suggest that changes in weather alone, that is, increase of temperature and humidity as spring and summer months arrive in the northern hemisphere, will not necessarily lead to declines in the case counts without the implementation of extensive public health intervention. So again, if I go back, you looking at that because the humidity, even when it was changing from 5 to 20%, did not lead to much change in the cases that they studied. They are of the view that most probably, again, most probably, it's not gonna change much when finally the summers arrive without any concrete extensive public health interventions like self-isolation, like lockdowns, trying to break the chain of transmission. But again, as I said, like, there is conflicting body of evidence. If we look at the similar viruses, which usually go down as the temperatures increase, and this one, which is quite a new virus, and we are yet into the summer months to actually see. This is more based on a prediction, but actually only time would tell us whether it leads to any actual decline in the transmission or not. Then coming to very important role of human behaviors, and that is where the focus of public health interventions are. And the human factors are quite important in the spread, because if you look at the data, COVID-19 has very quickly spread globally. So fine, we can understand the tourism industry, people going here and there, traveling around, and they have been bringing back the infection with them. But it has also reached the remote corners of the world, okay, where people, they don't go that frequently, so it has reached there as well. So the Chinese scientists have tried to look into that, and they think that the reason for the quick global spread is because of the asymptomatic transmission. Where the transmission is like occurs in those who are symptomatic people, then it's easy to break the transmission, because it's easy to identify the affected persons. You can isolate them, you can put them in quarantine, it's easy to do it for them, and it can easily break the chain of transmission. But when people are asymptomatic and they're still carrying the virus, they can quickly spread it to other people, and giving the or not for this coronavirus, or not is or not is the what we call as the transmission rate. So one affected person affects how many individuals, and it is thought that for or not for COVID-19 is 2 to 3. So one infected person infects it on average 2 to 3 people, and majority of this spread is by those people who have been asymptomatic or having very mild disease, which they don't think can be caused by COVID-19. They're probably thinking they have got a very mild cough or cold, and they have been spreading it to other humans. And that's how it's being spread, and it's spread very quickly all over the world. Other human factors are, we talk about self-isolation. And self-isolation is very important, because the thing is that if people start isolating themselves, they have less chance of spreading it to others. And it becomes a tricky here as well, because it's easy if somebody has got symptoms and they self-isolate themselves, fine, understandable. But those people who are asymptomatic, they would be simply thinking, why should I self-isolate myself? I haven't got any symptoms. But majority of these people are actually who are carrying it, but they don't know, inadvertently spreading it to. So that's why the crux of public health interventions is that majority of the public need to self-isolate themselves. So they should not be going out of their houses unless and until it's absolutely necessary. So the more they remain inside, what they would do is that they would simply lengthen the what we call the period of transmission. So if we look at let's say if one individual is spreading it to 2 to 3 individuals, and the way it spreads is we get a graph like this. So very quickly we get a peak of the cases, and then it goes down as the population develops some immunity. So let's say this is this dotted line is the capacity of the system. So let's say if the number of cases are below this, then your health system can cope with that, okay? But if it gets beyond that, then obviously the health system can't cope with them, and obviously the mortality would increase for severe cases, because the system cannot absorb them, and obviously they do not get quality care. So the concept is to spread out. So instead of having a peak quickly, if people self-isolate and they practice social distancing, remaining away from one another, maintaining at least 5 to 6 feet between themselves. So what would happen is that you would get a curve like this. So what is happening is that the total burden of infection is spread over a much wider time. So please keep it in mind that this does not mean that less people would be infected. If you look, the area under the curve would be more or less the same. So you will still be getting the infection. People would still be getting infected, and they would be getting infected over a prolonged period of time. But what is happening is the system still has got the capacity to deal with them. So let's say we say, okay, fine, if 100 people are affected in one day, probably we don't have the capacity in the hospital to deal with those 100. Like, for example, if all 100, they need ICU beds or something, and we don't have them. Let's say the hospital just has got 10 beds, okay, at most. So what would happen with those 90 people who require intensive care? Obviously, they would be treated in some other way, which might be suboptimal, and there are more chances they would die. So why not to spread these 100 cases rather than having in one day? If we spread it in 10 months, so you will be getting 10 cases every month, and it would be easy for the for the system to deal with them. So the system still had got the capacity. So the self isolation and social distancing concept actually leads to broadening of this curve, so that the infection is spread more uniformly over a broad period of time, so that the system has got the capacity to deal with them. At the same time, it's also imperative human factors, with regard to human factors, that good personal hygiene should be practiced. So that means washing your hands frequently, cleaning all those surfaces where you think might be contaminated with touchings, and soiling of by different types of body fluids. Okay, and the use of masks. Now, use of masks. Again, there are different school of thoughts. In the United Kingdom, masks are currently being used for very highly suspected cases. Public Health England is not advising people to those people who are what you call asymptomatic to wear masks. But in certain countries, Southeast Asian countries, have controlled, the spread of COVID-19 by very good meticulous control of personal hygiene, and big chunk of population have been wearing masks over there. And I would especially like to give the example of Taiwan, Hong Kong, and Japan, where people they are using masks when going outdoors, and it helps. Like if you have got something, it would actually prevent you from spreading it to others, and those who are asymptomatic, if they are wearing it, to some extent, obviously it's not foolproof, but it would decrease the the viral load going into into your airways. So it does help using masks, but again, it depends, in pandemics, because masks have to be used by the healthcare personnel. So the gap in the supply and demand can be a big factor, and that's why, in certain countries they're not advising the public to use masks, because then it leads to shortage for the healthcare personnel staff. But nevertheless, I mean, if we are beyond these factors of demand and supply, use of mask is a good strategy to break down the chain of transmission. This is another article which was published in the Epidemiology Journal back in 2014, and it was titled "The US 2019 H1N1 Influenza Epidemic: Quantifying the Impact of School Opening on the Reproductive Number." So this one is especially looking at remaining indoors, whether it leads to spread of infection or not. So the thing is that this article actually looked at the schools, and we know that COVID-19 actually affects mostly the adults and the elderly. I think if you look at the global statistics, less than 2% of those affected are kids. So whether it applies to that is very tricky. This article, if you see, they have looked at the transmission of influenza before and after opening the school in different states of United States. And when the schools open, like for example in Alabama, California, and Florida, if you see, once the schools opened here, you can see that there has been a constant increase in the number of cases, and this is true for almost all the states. Why? Because when the schools are open, kids are very close to one another in schools and in daycare, nurseries, and things like that, and they usually spread it to one another. As I said earlier, that in case of COVID-19, most of the cases have been in the 30 to 79 age group. Obviously 3% of those above 80 years have also been affected, and this one is also on the rise, depending on whether the populations have got a higher number of people beyond this age group. But again, as I said, it's mostly a disease of the elderly people. Very few, less than 2% of the of this category, which is considered the pediatric category, they have been affected. So whether remaining indoors, the schools have been closed recently, whether that would help or not is questionable. But again, there is another theory to that as well, that because kids, they are quite commonly affected by other types of coronaviruses, it is thought that perhaps cross immunity is what is saving them from harboring severe COVID-19 infection. And it is speculated that majority of the kids would be having asymptomatic or mild disease. The thing is that they might be spreading it from one to another without even knowing that they have got the infection. So that's why the schools have been closed, and they think that that might also help in reducing the spread of the disease. But again, as I said, because it's not clear, only time would tell whether this really works or not. Moving on to the third factor, that is the depletion of the host. Again, as we in infections, we always say that a person who is susceptible gets the infection. Like for example, somebody who is already immune to that disease, okay, infection, he would not get it. So again, we have to see whether COVID-19 infection gives you lifelong immunity, or whether you can still get reinfection after that. It's too early to say. But if we apply the general principles of herd immunity, we will see whether that can help us in in breaking the transmission of infection or not. So herd immunity, the concept comes from the herd, and herd is a sort of is a herd of cattle. So the underlying principle in herd immunity is that basically what it is it's a proportion of population that needs to be immune to a particular infection. It can be a natural immunity, or it could be sort of artificial immunity in the form of being immunized. And what happens is that this immune or immunized proportion actually helps in protecting the susceptible population from getting the infection. So what does that mean? Again, we have to look at the or not of any infective disease. And or not is the number of people that an infected person can transmit infection to. So if the or not is equal to 1, it simply means if there is one person with infection, he is spreading it to another one person, and he would spread it to another one person. So you will get a constant infection, and the numbers would not rise, but you will have a sort of a what we call as sporadic or endemic presence of the disease in a given population, because somebody would be getting infected, but then again the increase would be arithmetic. If or not is greater than 1, it simply means a person is transmitting infection to more than one person, and in that case, over a period of time, what would happen, the graph would always rise. So then over a period of time, the number of infected peoples would increase. If the or not is less than 1, it simply means once an infection is there, it's going to die out, because one person is infecting less than one person. So herd immunity means, like for example, if I draw a diagram, here are people, different people in the population, and some of them, let's say, are immunized. So for example, if I say this is immunized, okay, this is immunized, this is immunized, he is immunized, okay, he is immunized, this one is immunized. So this one is, let's say, this is the infected case, okay. So what would happen, this infected case cannot cause infection to this person, because in between, let's say, there are immune individuals. He can only infect this one, okay, and after some time they both will become asymptomatic if the infection recovers. So what would happen, they would also develop immunity. So these, let's say, this one, this one, this one, they are still unimmunized, but this is the proportion of the immunized individual which is necessary in order to protect these individuals. And by formula and in statistics, it is calculated that herd immunity is equal to R naught minus 1 divided by or not. So what does that mean? When we say or not for COVID-19 is somewhere between 2 to 3. So if we take this one, if it is 2, then herd immunity would be equal to 2 minus 1 divided by 2, which would be equal to 1 by 2, which means 0.5 or 50%. If we take the worst case scenario, that is 3, then the herd immunity would be 3 minus 1 divided by 3 would be equal to 2 by 3, which would be equal to 0.67 or 67%. So in other words, what we mean that at least if we are looking at the worst figure, we need at least 67% of the population being immune in order to protect the rest 33% who are vulnerable. So since we don't have a vaccine at the moment, either if we had an effective vaccine, we need to immunize, need to immunize 67% of the population in order to protect the other 33%. Like for example, if we would have done that and the rest 33% would still unimmunized, it would lead to a sort of a constant presence of the disease, but it would not lead to epidemic, so it would not lead to an epidemic proportion, or it would not lead to sudden increase in the number of cases. It would be more of a sort of an endemic thing. And with the passage of time, okay, even that endemic thing, as more and more people are getting immunized, it eventually falls down and eventually goes down eventually, and you will be getting very few, ultimately leads to sporadic cases if somebody gets infection off and on. But because we don't have a vaccine at the moment, simply those people who are getting infected and they are getting recovered, if they've got enough immune system, given the fact that they cannot be reinfected and that immunity is long lasting, only then this herd immunity would be able to protect the rest 33% of the population. So again, because we don't have any vaccine, unless and until we reach this figure by symptomatic or asymptomatic infection, ultimately people getting the immunity, active immunity in one form or the other, the rest of the population would still be susceptible. So looking at the current figures, it seems like the disease would still go high. I don't think we have crossed the corner as far as the peak of the epidemic is concerned. So I think the number of cases are going to rise till naturally the herd immunity comes into action, and then the rest of the population can be protected. But we still have to see that, because it's not very clear. We still, though some research have been done, we are still not very clear as to what are the other factors that actually help in propagation and transmission of this infection. So with the passage of times, as things become more and more clear, we would have more answers to these questions. So this was in a nutshell a discussion on some of the biological, or what I would call human factors, the herd immunity related factors, and the seasonal variations, whether that would help in the control of transmission of COVID-19 or not. Thank you very much for listening to me. Again, as I said, if you like the lecture, please do subscribe, comment, you can ask me. And I would end up on this famous Chinese, they say it's a curse that may you live in interesting times. And I think we are living in interesting times, because after the great Spanish flu of 1918 and 19, this is something which we never expected, and the unexpected happened. And we still have to see how it unfolds in the future. And fingers crossed. Thank you very much once again for listening with me. Have a good day. Thank you. Bye.